It's Dr. Carla here on this week's Wisdom Wednesday, and today I'm going to talk about all of the women, or talk to all of the women who are thinking about having a baby or having a baby and are wondering about exercise. And I've pulled a lot of research, and there's actually some new stuff that just came out as well about why you should be exercising while you're pregnant. So, it's good for you. And it's good for your body, and it can be really good for your baby too. There was a study that was just put out through Sweden and the Nordic countries that involved 130 female elite athletes. And typically this rigorous activity has been frowned upon in the OBGYN world. However, the studies show that they didn't have any higher chance of C-section, and their babies were as healthy, if not healthier, than the women who didn't exercise during pregnancy. So I think the fear factor needs to be over. Some high points about exercising when you're pregnant is that you have improved weight management. So by exercising, you get your endorphin release, and you're less likely to reach for all that crap food that also gives you that endorphin release. So you're getting that high off of exercise instead of food. You have a reduced incidence of gestational diabetes, and we really don't want that because we don't want it to stick around after you're done being pregnant. You have a decreased incidence of preeclampsia. You typically have a better body image. If you're doing something healthy for yourself, you're going to feel much better about yourself. You have a better physiological well-being, meaning you're going to have decreased chances of depression and anxiety and postpartum depression if you are exercising during pregnancy. You have actually a reduced chance of lower back pain, and this is one that confuses a lot of people. However, when you have a reduced chance of lower back pain, it's because you're doing resistance training, you're doing aerobic capacity training, and you're having your joints move, which is better for you. You actually have improved fetal development, so your baby is going to develop better than if you weren't exercising. Women state that their labor is easier, and one of the biggest concerns about exercise is that you have a higher chance of miscarriage, and that is actually not true when they've studied thousands of women. And you actually have a reduced chance of joint-related injuries because you're using your joints on the regular basis, particularly with resistance training, and you're less likely to have joint-related issues when you come out. So in CrossFit, we give a few guidelines and modifications in your first, second, and third trimester. And we also give you this nice 6-page document that you can look over, talk to your significant other, share it with your doctor so that they know that you're in the know about what is okay and not okay during pregnancy. Now, I have gotten a question, should I start CrossFit when I just found out I'm pregnant, I want to do something healthy, should I start CrossFit? This is my own personal opinion. I think doing things such as boot camps and movement-based classes are great. Sometimes getting into CrossFit isn't something that I'd recommend. I would do something that your body is relatively used to doing because that's what your body's used to. I'd say if you want to do CrossFit, wait until after you're done, wait until your body's regrouped a little bit before you would start that. And then we talk about the fourth trimester of when do I get back to my physical activity or CrossFit. So a lot of things happen during pregnancy. A lot of pelvic floors aren't functioning right. Sometimes the diaphragm gets pushed up and it doesn't really move and function when you breathe properly. Other times you have diastasis recti where your abs split. You might also have a C-section, or you might have tearing. So there's a lot of things that happen during that pregnancy. And so working with a healthcare professional to get you back is probably a recommended way so that you are in communication with them and your coach about how do I go about being healthy but also getting my exercise in, because that helps you feel better. And once you're usually 6 or more weeks out and you're doing healthy, we can start you back to some minimal exercise and really work on getting your movement patterns back to the way they were. It sometimes takes a while, and you're not going to use the same loads, you're not going to be able to lift the same. Once you get 3 to 6 months out, you'll start to be able to doing a little bit more, but depending upon how difficult your pregnancy is, it might take you a year before you feel completely normal again. But that is what we are here for, and your coaches are here for, to help you get back to feeling your best self. Thanks for tuning in.